Awesome. So we are at 12:30. Let's officially start. Good afternoon and welcome everyone. Thank you for joining us. This is our way to observe Earth Day 2024. When at AltaMed, we were thinking about, what do we do for Earth Day? It's such an important day for all of us. And, we couldn't celebrate Earth Day without really talking about the important role of civic engagement on the environment and the important role of activism and advocacy. And so you're going to hear from some amazing speakers and great friends. And so let's go ahead and get started. For those of you who weren't on the webinar yet, when I introduce myself, my name is Lisette Escobedo. I am the Vice President of Government Relations at AltaMed Health Services. I've been with AltaMed for actually, tomorrow is my 3rd-year anniversary at AltaMed. And so very excited to do specifically, not just the government relations work at the organization, but I also oversee our civic engagement team. We are one of the few federally qualified health centers in the nation to actually have a full team that focuses on civic health. And so our efforts include integrating civic engagement and education into all of our clinics throughout both LA County and Orange County to make sure that as our patients are receiving information about their physical health, their mental health, they're also receiving information around their civic health, and that they understand the important role that they can play in determining representation in their communities, in the country. And just this year, we actually launched a partnership with the California Primary Care Association, various regional consortia for community health centers, a lot of community-based organizations who are probably joining us here today as well, to launch Civic Health Alliance throughout 6 different regions of the state, so that we were consistently having these conversations, not just at places where AltaMed serves the community, but also in other communities throughout the state by looking at our integrated civic engagement model to do this. And so for us, this conversation is timely. For us, this work is important. And the speakers today are just going to shed so much more light on this effort. And just on a very brief personal note, before I get into really talking about why we're here today, I am someone who was born and raised in Southeast LA, so shout out to Dr. Franco and all of the Southeast LA Collaborative, and understand firsthand the important role that environmental justice and fighting for environmental justice in our communities can play in how our communities look, in the policies that we have, in the leaders that we have that represent us. And it has been one of the communities that has been severely impacted by various issues, by pollution, by pollutants, by carcinogens, right? And so all of our speakers are going to talk a little bit about their experience in that space and why civic health is health, and also why environmental justice is part of addressing healthcare equity. And so I want to begin again by thanking our generous funders who make these kind of conversations and this work possible and have invested in the work that has been done at AltaMed and amongst some of our other community-based organizations to uplift environmental justice in the communities we serve and to uplift the important role of civic health. And so definitely a shout out to the Southeast LA Collaborative, to the California Primary Care Association, the California Endowment, the California Community Foundation, Latino Community Foundation, and tons of others who have provided their generous support for this type of work. Sorry, should have had water here. I also want to thank many individuals and organizations who have joined AltaMed through, again, our My Vote, My Health program to empower our communities to express themselves through civic engagement and civic health. I already thanked a lot of folks, right? The CPCA, our CPCA partners, but I also want to thank folks like COFAM, Latino Health Alliance, OCORD in Orange County, and many, many other key leaders and organizations, the OC Coalition. I'd be remiss if I didn't mention them for all of the work that they do in this space. And of course, I want to thank our amazing speakers and great friends who are here today. My colleague and one of the fiercest civic engagement champions that we have at AltaMed, who also serves as Chief Health Correspondent and Senior Vice President, Dr. Ilan Shapiro. Wave, Dr. Shapiro, we see you. I'm sure everybody knows him already, but Dr. Shapiro is also a practicing pediatrician. And so he's going to share a little bit more about his insight on environmental justice and the impact of children. We also have my dear amiga, Dr. Wilma Franco, who is the executive director of the Southeast LA Collaborative. Hola, Dr. Franco, nice to have you here. And last but not least, we have Hilda Nucete, Senior Director of Civic Engagement at the League of Conservation Voters, who have just done phenomenal work in communities and really bringing to the forefront environmental issues and the role of advocacy in addressing those. And so today, as I mentioned earlier, as part of our Earth Day efforts and in celebration here at AltaMed around Earth Day, we have set aside this time to engage in a conversation on the intersection of environmental justice, patient health and community health, and how civic engagement efforts empower the communities we serve to raise their voices, advocate, and build a better and healthier world. Today, you'll hear from three amazing panelists who have practical and real experience and expertise working in the intersections of environmental justice advocacy, community health, and civic participation. And so before we get started, just to provide a little bit of perspective on really the critical conversation we're going to have today, I do want to begin by sharing a brief video clip that begins to encapsulate why we observe Earth Day by connecting the work of AltaMed as a federally qualified health center, our work as My Vote, My Health, and our civic engagement work to environmental justice. This short clip is from the PBS documentary called Earth Focus, We Are Where We Live, and it introduces us to this idea that our physical environment is very much influenced and directly that influences and directly impacts our health.
Why don't we deserve the right to be healthy? Why is it so easy to be able to afford the things that are harming us?
Your zip code determines more your life expectancy than your DNA code now.
Over 2,000 homes have contaminated yards. Nobody should be living in those situations.
And in the United States, the truth is that the poor pay the price.
Thank you so much. And so for folks we just wanted to show you a clip. This is like an hour long, but we wanted to also really share the important role again of the environment and the physical space in which we live, and why everyone in this webinar today is doing something about it, and that plays in our the health of our communities. And so now I want to transition over to our speakers. You may have recognized some of the communities even in our clinics in this clip that you just saw. Because many of us live in those communities. AltaMed's mission and its history is rooted in serving communities where they're at, where there is most need. Communities whose health needs healing, and it is no coincidence that these are all the communities who have adverse health outcomes because of the environment they are in. FQHCs, or federally qualified health centers like AltaMed, serve some of the most underserved, under-resourced, and most vulnerable and at times disenfranchised communities in the regions, in the state, and in the country. The conditions that often make those communities ill are often exacerbated by environmental factors: access to green spaces and safe streets, healthy and clean air in neighborhoods and with high commercial traffic, and access to green spaces that encourage physical activity, to name a few examples. In order to address chronic illness and holistic health, we must advocate for environmental protections, more accountability, and preventative policies and measures that will protect these often voiceless communities. This is a major reason why the My Vote, My Health program, a civic engagement effort, again led by AltaMed, came into existence in an effort to empower the communities we serve to have a voice in the democratic process and build power that will lead to better policies, more accountability, and better health outcomes. So let's jump into this conversation. Our first speaker, Dr. Ilan Shapiro, Senior Vice President and Chief Health Correspondent here at AltaMed, I need my glasses today, who will share with us about why environmental justice and healthy community policies are critical to ensuring a healthier future for our children. And so welcome, Dr. Shapiro.
Thank you so much. Thank you so much. It's an honor and a pleasure to be here. And, having Hilda, Dr. Franco, and my amazing friend and also amazing community leader, Lisette here, brings me a lot of memories. And as a pediatrician, but most importantly as a father, we want the best for our children. We want to have uh, them enjoy life, have fun. There will be struggles, but one of the things that hurts me the most is when patients come into my door, go to urgent care, and I see them again and again and again and again and again. And practically, I know that, without being scheduled, I know that I will be seeing them. And they come with me with that cough that doesn't go away, that asthma that it's getting worse. And I do know the guidelines, and I have amazing pediatricians around me and even specialists, and I know how to treat it. And I give medications and I give everything. But at the moment that they are out there on the community, something is happening. I have seen it to the point that sadly, I just get the notice that they ended up on the hospital, that asthma is not getting better, that simply his lungs will be tainted for life. And even if I can give all the medications that I have, the reality is that I cannot change the air that they are breathing. I cannot change the industries, the highways, and absolutely everything that we have around our community at this moment. The connection between our environment, and our health, especially for our kids, it's a direct correlation. And not only that, there are other things that my community is also suffering with. We have had lead poisoning, hear me out, lead poisoning, something that happens in Mexico. We used to have like all the gas and everything else was actually leaded. Right now here in the US, we do not supposed to have that type of products. And it's something that I see every week. Our environment counts. Our health is there. When a kid is actually poisoned by lead, his brain doesn't develop, his speech is not going to be there. And of course, that will trickle for his or her entire life. Then we talked about asthma. We talked about lead. But also, weight problems that we're seeing around our community can be related to our environment. When we don't have safe spaces or spaces that actually are, good for our kids. All of them start trickling down and putting aside that hope, that better future, that feeling that we want our kids to have, that promise that us as parents or family members are trying to keep. But unless we're represented, unless we actually bring the treatment that is figuring out a way for our voices to be heard, that way, even though that we have the medications, we have the clinics, we start changing our environment. We start trickling down the importance of having green spaces, making sure that we have alternative ways of transportation, making sure that those resources that our community needs now continue to come towards us. We have a choice. We can put band-aids to other medical problems and mental health problems that we have, or we can start crafting and making sure that our promise that we did for our children is kept. That's why my body is my health. Por eso mi voto es mi salud. If we are not there, there will be a void. And that void, we already know that it's pollution, that it's lack of green spaces, and a broken promise. Thank you, Lisette.
Thank you so much, Dr. Shapiro. You've actually set the stage very nicely for us to welcome our next speaker, Dr. Wilma Franco. Dr. Romo Franco is the executive director of the Southeast LA Collaborative, a nonprofit in Southeast Los Angeles that is building power and driving systematic change through its member organizations and its many programs, and who work with member organizations that tackle a whole set of issues that are prevailing in this region. Dr. Franco and the CELA Collaborative have been engaged in the fight for environmental justice for many years now through both advocacy and direct action. And Dr. Franco will share with us how they've addressed environmental justice through advocacy. And so without further ado, Dr. Franco, the microphone is yours.
Awesome. Thank you so much, Lizette, and thank you to the panelists. It's a great honor to be in of you. But so just for those of you that don't know who the CELA Collaborative is, we are actually a network of organizations serving the Southeast region of LA County. So all of our, 94% Latino communities, right? That's 8 cities, 20 corporate areas, of which AltaMed is one of our collaborative members. And then so a lot of the work that we have done, right, was really stemmed from a lot of the long-term disinvestment and neglect that the communities in CELA have experienced. So there was a group of leaders, right, like, Lisette and a number of other folks, right, that said, why are our communities suffering this way, right? And I think when we talk about issues of environmental justice and climate and how it impacts our health, I think CELA, sadly, is one of those case studies where you're seeing a lot of this, right? We are the communities right next to the 710 that have been impacted by the transportation system, right? And the goods movement. And then really looking at, well, these are also communities that are very low income. So when we look at any of the data numbers, right, we have some of the worst cases of chronic disease like asthma, heart failure, obesity. But then when you look at the built environment, right, and I think that's one of those things that collectively, right, as stakeholders and as partners here in the Southeast, we're trying to address, like, what is that built environment? I know AltaMed speaks from it as the social determinants of health, right? Like, how is our community, our environment, like what we have access or don't have access to, impacting our quality of life, but also our health directly, right? And then so, we hear a lot from community around, community members that have said, I grew up with asthma because I was, here in CELA, and then I moved out of CELA and then it was gone, or I never had another, asthma attack, right? And then so when you hear those things, but you also hear a lot of these leaders that have, grown up in these communities that have not left and are raising their children here, and they're advocating, right? And I think, because we have this history, and then you look at, folks will say, well, how do you encourage like physical activity? Well, we also don't have access to green space. If you come to CELA, if you visit CELA, everything's cement, right? Everything, there is no green space. There's been a lot of work, a lot of advocacy done by groups like some of our partners, right? Like East Yard, Tree People, that are really kind of pushing the envelope on these conversations. But, East Yard is a perfect example of an organization that has been, doing the work, the difficult work, right? Like fighting exide, right? And addressing this long-standing challenges and contamination that exide has created in our communities and holding them accountable, right? But sometimes you think about that, and when we raise those kind of information and data points to folks, folks will say, yes, but that happened in the past. And it's like, yes, but it's still impacting the health of our communities. And if you want a more recent incident, then we can talk about the Delta fuel dumping in our communities, right? Another example of like, even, that happened in January of 2020, right before the pandemic, and nothing was done, right? I know AltaMed stepped in to provide some mental, some health support, but really, like, how are these challenges and just really severe situations happening in the community, right? And then so it was through this network of partners and leaders that we have been able to convene, right, that we were able to develop the CELA agenda. And I think one of the things, I'm actually in Sacramento talking about regional and climate and how to address these things at the state level, right? And I think that was one thing that came up for us here. It's like, we have to look at these issues from the intersectionality of it all, because in CELA, you can't talk about health and quality of life without talking about the environment, green space, access to quality food, and all these other intersected kind of pieces, right? Workforce development. I know one of the data points I will share here was, one of the biggest determinants of your health and the quality of your health is your income. You know, so when our families cannot afford healthcare, cannot afford to keep up with those pieces because they are living paycheck to paycheck, and oftentimes a paycheck away from being homeless, like how do they really look at these larger pieces, right? And then so we really look at what are those you know, systemic things that we can change. And I think those partnerships, the opportunity that we have to build on these type of initiatives like My Vote, My Health, right, are really encouraging. It's not just about raising the concerns, but it's also about voting. It's about those people that are empowered, that represent us, and that really can either set the tone for what our communities can have access to, or even the census, right? I know we led a massive campaign with the region, right, on the census. Like that is directly correlated to the amount of resources and funds that our communities receive. And then so that is part of the reason why for us, right, collectively, it's like, how do we support our partners that are doing this work, but then also how to, at a regional level, right? Not municipality, but municipality, because we are very small cities in Sela. How do we come together collectively to really push this larger Sela agenda and ensure that Sela receives its fair share of resources? So it's an honor to really do this work with all of these partners. And you know, I always share with Lisette, like I'm honored to be able to lead this, but there's so many leaders behind us. You know, we convene at close to 350 leaders, from community members all the way to our legislators. So thank you so much for the opportunity to continue to share this work.
Thank you so much, Dr. Franco. And I think definitely a shout out to you and your leadership, and a shout out to the Sela Collaborative. I think the Sela Collaborative in many ways was really born out of this need to hold folks accountable for the issues that were happening in Southeast LA. I remember what was 17 years ago or something like that, when we initially just kind of all sat down, right, and having the conversation of like what needs to happen in Southeast LA, right, for us to hold folks accountable, to have the leadership necessary, to bring in the funding, to address all of the environmental issues that are going on. And so, you know, here sparked really the need for change and movement building. And we saw new elected leaders, we saw changes across the board. We saw, you know, folks participating in the census, folks actually understanding what their elections mean. There were groups that actually were born out of the need to address the issue around, you know, Exide. I was actually working for the member of Congress in Southeast LA at that time, when folks were requesting direct action from the EPA to come into Southeast LA, and for, you know, months and months, it fell on deaf ears, right, until the communities organized and the demands and our collective kind of screams in many ways were heard, right? And here we are now with a movement called the Sela Collaborative, and with these efforts that continue on to hold folks accountable. And so, you know, a lot of work to do in Southeast LA, right? Near and dear to my heart, my hometown, but definitely a model to follow. And thank you, Dr. Franco, for your leadership, and the leadership for all the leaders that belong to this collective and just have been doing this great work. And now along that same vein of really organizing and advocating and building movement, I'm really excited to have our next guest with us, who I believe today is a launch of our partnership. We hope to continue to work with you all. And so up next, I'd like to welcome Hilda Nucete, who is Director of Civic Engagement at the League of Conservation Voters. The League of Conservation Voters has a very long history of leading advocacy campaigns at the intersection of civic engagement, environmental justice, and advocacy. They've been confronting environmental injustice, educating and raising awareness about the climate crisis, and strengthening our democracy throughout the entire United States. They are a national organization, and again, aside from California, do this everywhere else in the country, right? Just something small, right, to do. Today, Hilda will be speaking with us about building grassroots power, advancing policies that make our communities healthier, and how to hold policymakers accountable across the board. And so with that, our last but not least speaker, so I'll hand over the mic to you, Hilda, and welcome, and we hope to continue our partnership.
Of course. Thank you so much, Lisette. Such a pleasure to connect with you. Really, thank you so much for this opportunity of having me. And as you mentioned, the League of Conservation Voters really works to build power and protect people and the planet. And we know that we cannot have a healthy environment if we don't have a healthy democracy. And we know that historically, communities that have been disproportionately disenfranchised have also been the same communities that have been disproportionately impacted and polluted on. We see that the most cumulative impacts in our communities, we see them across communities of color, in Black neighborhoods, in Latino communities, in AAPI neighborhoods. That's where we're seeing it. And our organization really works on making sure that those communities that historically have been excluded for the electoral process are really the ones leading in the conversations and advancing those relationships in their community. Only when we know that low wealth, young people, rural voices are brought into our democratic process, we can actually have a reflected leadership that represents the values of those neighborhoods. We see that time after time after time. It's so interesting because sometimes we'll see like voter registration is the key to advancing this work, which it is so much, but also it is sometimes thought as, why would we even have voter registration? And why would we even have those parameters and those barriers that remove people from this work? So even in our work, a lot of the times what we want to ensure is that we're advancing access to democracy. Not just voter registration, but how do we have easier access to drop-off locations? Not every state, it's like California, I'm based in Colorado. We call it the Colorado model, where we have really California, one of the best voting laws in the country. But not every state it's like ours, where it's so difficult to register to vote, to turn in your ballot, where you have people policing, polling drop-off boxes and intimidating individuals. And when there's so many times that are created misinformation to drive communities away from the polls. And I love how, Dr. Shapiro, Dr. Franco were able to tap in a little bit on the census and how this work is so similar. In so many instances, we're tapping into those hard to reach communities. If I were to put a voter registration form in a poll somewhere, and it was so easy, people would do it. But the reality is the convincing conversations that we're having with individuals about why should I vote? Maybe I don't care about what's happening at the federal level, but I care maybe about my public transit that's going to take me to my medical visit. I care about my insurance rates. I care about my local schools. I care about those issues because they truly affect me. So that's kind of how we engage community members and start from there and really talk about the cumulative impacts and the issues that are surrounding them around why it's important for them to vote. For me, it's actually very personal, this space, because as Dr. Shapiro, and I love that you're mentioning as a pediatrician and really bringing this conversation as young people and people are being built into these built environments. I'm originally from Venezuela and I grew up in an oil camp. Oil camps in Venezuela are sort of like military bases where your family lives there, your school is there, all of those pieces. And since I have memory, I have asthma and I'm here, I got my little inhaler and my little extender thing, so I wouldn't hurt myself. But interesting, as you were what Dr. Franco was mentioning, when I moved away from the oil camps to the city, which you will think will be a lot more polluted due to car pollution, my asthma ceased. And then moving to the United States in Colorado, where many instances people think that is one of the crispiest air, so clean, mountains, and then actually realizing the cumulative impacts in the communities where I live is actually I was living in the most polluted zip code in the nation. I was actually, it's one of the most polluted zip codes in the state. I was actually living really close to an oil refinery that's constantly flaring and it has 148 violators of federal environmental law. And those are all in neighborhoods that are 85 to 95% people of color, Latinos, la raza, nuestra gente. So I realized that really it is not just that by magic, como by magia, that these spaces were created that were in our neighborhoods were built in there. But it also was that it was assumed that our communities were not going to elevate their voices and protect themselves against these corporate polluters. And so many systems that have been implemented to keep communities in that space. Sort of thinking do I have to battle between my job and my possible health? And I think in many instances in organization, we say we can do both. We can make sure that we advance our communities, and then we can also advance environmental justice because all these issues are interconnected. My mom, as a widow mom, If I had an asthma attack, she had to either decide if she was going to go to work or she was going to drop me off to my grandma. I was going to miss a day of school. And those all were economic decisions that she was making. She was making financial decisions that really were connected to her style of life. And really, I think in many instances, when we talked about environment and the connections to health, we tend to forget that it's not just you might have a little bit of a cough or asthma, but it's really lifestyle that is being affecting our communities. And also when we look at access to environment and access to our communities and to public spaces and green spaces that we're talking, it's also access to mental health. And we see that there is a correlation that a lot of times like kids cannot go outside because they have asthma and they don't have green spaces. But the only way to really battle asthma and those pieces is to be able actually to have in cleaner air, be surrounded by this by spaces that support us so much. So it's a little bit of sort of my personal story of why I care so much about this work. The work that we're doing across the country, as I mentioned, is really making sure that those communities that historically have been disenfranchised, how are we cutting and closing that voter registration gap between white voters and people of color? And by default, within the different programs that we have candidate recruitment campaigns, to be able to encourage individuals from the community to say, actually, if not me, then who? If I'm not running for office, then who is going to elevate my issues in my community? By bringing policies and ballot initiatives in the community. And so many of those pieces is that how we can really bring this space into action. And I guess I cannot end this conversation. I can talk about how important it is to register to vote and to vote for your values and elevate your voice and making sure that your community is protected against polluters. But really, one of the biggest ways that you can do to protect your family and your community is by creating a culture of voting in your family. We know that in many instances, we're getting those ballots in the mails, moms, dad, people people close in our community that are reminders, and they're the people that are being able to have conversations and sit down at the dinner table, hacer sobremesa, sit down after dinner and really talk about what does it mean for this ballot initiative, for this candidate, and have those healthy conversations in our dinner table and make sure that those are part of our culture and make sure that those are part of the conversations that we have with our family and friends and reminding them, are you registered to vote? Are you voting? Are you turning in your ballot? That those become not just kind of extraneous situations in which it only has to be ignited by hate or by an sort of an immediate action, but it actually just becomes part of our normal culture. It doesn't become voting just an act of self-defense. Because for me, in my lifetime of the work that I do, working on environmental justice and civic engagement has become an act of self-defense to make sure that my community has clean air for the future. Thank you.
Thank you so much, Ilan. And I know you mentioned some of the kind of calls to action already, but what would be, the kind of 3 things that you would, for folks who are, who are wanting to get more involved or who are wanting to take specific actions, right, to address the environmental issues in their communities? What are the top 3 things that you would ask folks to do?
Yeah, of course. And it can be, there bigger actions that people can take, and there's most actions that people can take at home. One of them, I always say, making sure that you're registered to vote. In your city and in your community, there's most likely a climate action team that is very involved in your city, from small actions as like doing a park cleanup to a large action as passing a ballot initiative around trash and recycling. So making sure that you are able to connect, and we know that everybody has different levels of engagement according to their time capacity and abilities in this space, but really being able to tap into those community spaces in your city and in your state. Also, it starts at home. And I will say many instances we think that we need to do these crazy political actions and sit-ins and protests in order to move environment work. And I think it's in many instances like, what are we doing in our personal spaces at home? Are we recycling? Are we reusing that Ziploc bag? Are we getting it washed? Are we making sure that we're not doing so much consumerism? Are we thrift shopping? Maybe. Are we doing that reusable water bottle? Are we maybe bringing our cups to that, for that coffee drink? I think in many instances, small actions on environment really do not take that much of that extra step. It just takes a little bit of intentionality. But on another space, being just part of the political process and bringing your story and your personal experience to your vote and to vote on your values, so important. And I guess it's the last one and kind of repeating it. There are many opportunities in your city that you can join. There's either an environmental club, a committee, one of those spaces. And also feel free to be, if you don't see somebody like yourself reflected in those spaces, in that community environmental board, run for that board. Be in those spaces. Actually, I was seeing myself that I was so disconnected to my staff that I applied to be a health equity commissioner in my state of Colorado, and I'm able to serve in that way. So there are opportunities that doesn't necessarily need to be running for office or, or specifically running a campaign, but there are ways that your leadership and your experience can be elevated in leadership positions. If not you, then who?
That is awesome. I couldn't have said it any better. That was wonderful. And so I do want to briefly pick on the rest of our panelists who also give us some actions. Tough act to follow because I feel like Hilda hit the nail on the head on a lot of them. But just to add to what Hilda mentioned as just very specific steps or calls to action, right, from folks. I'll go to you, Dr. Shapiro, for what are the 3 things that folks should be doing on this Earth Day or just in general to address environmental justice issues in their community? From your perspective.
Everything starts with us. And by us, meaning this us, our own person. Then are we doing the correct thing? That's the first thing. Are we happy with our surroundings? And are we participating in civic health? If one of those is a no, we're actually not helping the environment. We're not helping our community, and especially our children. Then we need to participate. We need to be part of that. And I completely understand, and I have a lot of families that I take care of that, for one reason or another, they cannot participate in certain things. And that's okay. But como digo en español, hay que pasar el chisme. We need to share information of what's happening, on how we can activate things, on how can we actually make sure that our voice is counted for, because our little ones in many parts of our community cannot do so. Then we need to be there for them.
Thank you, Dr. Shapiro. Dr. Franco, what are your calls to action?
Yeah, no, I love that when you said, because I feel like a lot of the promotoras always say to us, like, and their words, right, to their community when we speak with them is oftentimes like, get engaged, because there's community members that can't do that, right? So like, if you can vote, vote, because there's community members that are not able to do that. But even then, I know that a lot of our promotoras, some of them are not able to vote, but they're very much engaged, right? And it's finding opportunities where you can not only build community, right, but you can also educate yourself. I think for the CBOs, I think oftentimes, right, we tend to try to stay away from what seems a little political, right? But there's ways that you can engage, because a lot of it is as community organizations and as stakeholders in the community, like, we understand community, and it's our voices that need to be at the table to be able to actually make meaningful change happen for our community members, right? And then so being involved in those spaces, or even finding ways of collaborating. I think that's the one thing that we try to encourage a lot of, right? Like, we might have a specific way to engage community. You might have different strategies, like how do we bring and co-create something that can be more impactful and can reach more community. I think the one other space that I would share, because this is something where I grew up, right? The community, the faith-based community. A lot of us go to church or go to different communities. Like, how are we using and tapping into those community members in those spaces to not only share resources, but also open up the doors for other partners that are doing this work to actually come in and educate our community. Because at the end of the day, right, like, those are the community members that are oftentimes suffering, and how do we create that community and support system around each other?
That's amazing. So thank you to all of our speakers for sharing your your experience, your expertise, your calls to action. It's been such a wonderful conversation. The broad takeaway here from our conversation today is that we all have the power to engage and to take action. As providers working in the exam room, as Dr. Shapiro said earlier, right? Health is only influenced so much by medical professionals. The rest of the health is environmental. So if you are addressing the immediate health needs of your patient, it is important to address the role that they can take in influencing the environmental needs of your patients. But even in the exam room, again, this can be a place to improve health by including a check on the patient's civic health, right? For many of our doctors, they actually have a handy dandy voter registration badge that they take in with them that has a QR code. So that when they're having a conversation with the patient and the patient perhaps says, well, I don't even know where to register to vote or where to check, right? They actually have a QR code that they can bring up. If you are one of our providers who doesn't have their voter registration badge, please do reach out to us, let us know, and I'll share in a slide where you can reach out to us in just a second. But in essence, we all have a role to play. Whether, again, you're a provider, you're a health professional, you're a nonprofit organization, a community leader, a business leader, or simply a member in your community. We are all healthier when we take the time to vote for our health at the ballot box, to register to vote, to participate in every decennial census. You know, we're 6 years away, but it's around the corner. But we are also healthier when we vote for our environment at the ballot box, because we can separate the environment we live in from we can't separate, the environment we live in from our personal or community health. And there are policies made by decision makers who are elected who impact our health. Hilda talks a little bit about this, right? But so folks understand, you have your local elected officials that sometimes will make decisions on where your parks are placed, how the funding at the county level is used, how you will invest specific funds, what decisions are made. The commissions are an important one. Run for office as well, right? Run for your city councils, run for your county opportunities and commissions. But at the state level, you have your state legislators that determine what the budget priorities in many ways are for the governor and how he invests in the environment and in taking particular measures. And at the federal level, we have our members of Congress that make key decisions and that in certain respects oversee the Environmental Protection Agency, right? Which a lot of these decisions are made, right, through various hearings that we're not a part of. But also a quick mention of what are called EIR reports, environmental impact reports, that when different agencies come into our communities and there's a public comment process, usually what do they say? They say, well, we had a public comment process, we fulfilled the need, but nobody came and provided public comment. And usually the meeting dates are hidden somewhere, right? The time doesn't work for everyone. And so definitely be involved with your activism organism in your community to understand where those are, what the opportunities are to engage in public comment. And so with all this in mind, I want to thank our amazing group of speakers, our funders and collaborators. And I want to thank everyone who took a time out of their day to join us for this amazing afternoon conversation during a few days after Earth Day, but we're still within the week. And so as we close, I want to remind us all that this is an election year. We are just a few months away from a very important elections where everyone that we talked about today, city, county, state, federal, are on the ballot, including some very specific ballot measures on funding for healthcare and other important issues that are both local ballot measures, statewide ballot measures. And so I want to bring up on the screen a QR code that is to our website for My Vote My Health, which is myvotemyhealth.org, where you can download some resources. If you're a healthcare organization, if you're a CBO, if you're just a community leader in your communities, you can download tons of resources, print them out, make them available. You can download posters. You can just get information. And for those of you who don't know, at least locally, AltaMed will be hosting over 15 voting locations in an effort to make voting accessible in the areas in the spaces where community goes and gets healthcare. So please be on the lookout. If you can vote at an AltaMed location and it's easy for you, this also goes out for some of our staff who are joining us today. And again, every election is an opportunity to vote for your health. And every election is an opportunity to vote for a healthier environment, more just policies, and accountable government. Thank you for joining us today, and have a great rest of your day. And we hope that each of you will vote this November, encourage others to vote, encourage others to register. And if not, we hope to see you at a public comment process in a city near you. Thank you all so much. And here are some important election dates. Please mark your calendars. November 5th is the last day to vote, but it starts earlier than that. So mark your calendars and don't miss this election, because it will be a life-changing one for all of our communities. Thank you all so much, and we will stay in touch.